If you are going to use session notes or scheduler in OT Wizard, you will definitely want to create a plan of care. I'm going to show you how to do it and how simple it is. So if you have created a guided evaluation inside OT Wizard for a student, this is going to be really, really simple for you. But even if you haven't, I'm going to show you how to create a manual plan of care. And a manual plan of care would be like if you didn't do the guided evaluation in OT Wizard, and maybe you're just migrating a plan of care over. So first of all, you'll create the new plan of care. You'll choose the student that you're going to, that you need it for. You have to make sure that this is in your student profile first, or else it's not going to populate. Next, you're going to determine which type of plan of care you need. So this is going to depend on the type of language that you get and the goals and how their goals are written. So for today, I'm choosing a medical. A manual would be like exactly what it says, create from scratch, but you really want to use this if you can, because it's going to make it so simple. Now you'll notice that when you choose you have to choose one from Report Wizard. So if you created your guided evaluation, but you never created the report, meaning there's no narrative report document, you have to do that first in Report Wizard. So you can look at that video to show you exactly how to do that. Now, just from looking at this, I can see right here that the medical is blue and I have a medical-based report here. I can only select this. If I chose educational, then I could choose any of the tags that had the ED, but these have to match or else it'd be all wonky. So I'm choosing the medical, and then I'll go ahead and go down and I'm going to choose, if you actually are a medical provider, you'll want to make sure you choose your place of service. Otherwise, it doesn't matter. And then this will be the start date and the end date. So let's say I want my plan of care to start next week and I want it to be for 6 months. And that's what's typical for insurance-based authorization. So then I would just go ahead and click generate from report, and I'm going to wait a few seconds. This usually takes about maybe 10 or 15 seconds. But the beauty is that it's going to pull all of that information directly from that report, and any goals that are going to be here are going to be goals that should be considered by you based on the developmental order and that a child makes progress on, or the developmental order, the priority, I guess I should say. But you can see here, so we have, first of all, we have the start date, all this up here. You can click here to edit the dates if you need to, okay? And then up here, you have 4 different tabs. So the tabs are goals. So first of all, you have 2 long-term goals that are usually given to you, and about 5 short-term goals, unless if the scores were pretty high on the guided evaluation report, then you may not see any goals because it may say OT is probably not recommended. But you can create extra goals. You can edit these, but I want to show you. So this little badge means it's a short-term goal. This is the domain area. This just means if the goal is active or not. What's the goal measurement? So this is saying duration because this is 10 seconds. So this is duration goal. For instance, this one is a frequency goal. So it's 10 consecutive hops without loss of balance. But anyway, and this is just the area of the goal, just kind of the short descriptor of what the goal is actually looking to do. So you can go through, and there's going to be a video specifically on how to do these goals, but I'm just going to show you real quick on this. You can save this to your own goal bank by clicking here, or if you need to change any of these, like say maybe you think that they can't do it for 10 seconds, you could change that or whatever you want to. But also it'll have the goal preview here. You can edit that manually. And then it'll show you the baseline. So let's say you do want to do this goal. This kind of keeps in mind what the baseline is from that evaluation data. So you know exactly what it is, because obviously you don't want to make a goal that's below the baseline, or certainly not too high either. But so it needs to, kind of stay close to that. So, okay, so these are your goals. And then it went ahead and pulled over your current level of function. All of these can be edited by you just by doing that. Interventions, the interventions pull over to the different goal areas, but also these are areas that where the student scored like below 70% on the evaluation. Building a unit. So what I would do here is I was a medical provider. When I click here, I would just go ahead and determine how often I want to see this child. And whatever you do, you can see right now it says max visits and max units. So it'll go ahead and start calculating that for you. And then you can go on down here. You can see some different things about it. You'll want to add the diagnosis code in here. If it is an educational plan of care, you should be able to also add the exceptionality in here. So that way it will follow your data. Let's see what else here. So you just make sure you save the changes. There's details here if you need to see those. But when you are like you're happy with what you've done, you're going to click the activate it. And then I'm going to show you on the next video about session notes, about how this plan of care will populate into your session notes so you can document clearly on those goals. But also how it will help you for tracking those visits, like how many visits are left in this plan of care. Are you over too many visits, etc.? If you need to download the plan of care for yourself, like so that way you have a written copy of the finished goals and like the frequency, just click there and it'll download it for you. But the plan of care is really cool. It's a lot of fun and certainly will help you with creating great session notes and response to intervention data.